Dr. Josh Luke here with the Health Wealth Podcast and Radio Show. Welcome to another episode. I'm excited to be here with a friend of mine who I've connected with on LinkedIn. Haven't met in person yet, but have learned a lot from about marketing and social media. We co-authored an article on LinkedIn. Joining me today is Manu Swish Goswami. Manu, welcome to the show.
Thanks so much for having me. Appreciate it.
Yeah. You know, a lot of folks might say, hey, wait, I knew a man from LinkedIn and from Twitter. Like, he's from Canada. Why is Josh talking to him? Well, I thought it would be a great opportunity to talk to someone who's experienced healthcare in not just two, but actually three different countries. Because what I learned about Manu, because I pay attention on social media, is that he grew up in Singapore. He just was sharing a few weeks ago on social that he was over there for the first time in a long time since he left, and it was a good experience for him. And so I wanted to draw on a very similar parallel of, hey, tell us what you remember about healthcare in Singapore versus Canada versus the States. And so we're going to open with that question. But before I did, I wanted to just ask Swish if he would just give us a little background on himself as one of the founders of an organization called Dunk, so you guys can kind of know who he is and what he does before we ask him to kind of leave his professional comfort zone and just talk about healthcare with us.
For sure. I love talking about healthcare. But being Canadian, I mean, I've been blessed in a very, very great situation. I'll get into that a bit later. But for me, yeah, I was born in Singapore, was a very inquisitive kid growing up, did a number of things, played cricket, played basketball, wrote my own comic books, started my small little organizations that I thought were businesses but weren't really and were like one-off spinning deals. And I just grew up in a very cool household where both my parents had seen what it was like growing up with a traditional occupation, and they didn't want that for me and were encouraging me to do whatever I wanted. So one of my early childhood dreams was becoming an actor because I felt like I could be anyone. I could be an actor who played a doctor one day and then played an engineer tomorrow and a lawyer the next day. And I loved being able to do so much because my mind was everywhere. And then I kind of wanted to get into entrepreneurship after when I started seeing, some of my idols, some of the people even in my community starting businesses, feeling very free about what they could do. So started being really well recognized in Canada specifically, moved out to New York about 8 months ago, and have been living alone there as a 20-year-old. I created an organization called Dunk. We have a media network of about 10 million followers hyper-focused on basketball, and so we work with brands to amplify their content and with teams and players to directly help them on social media and how they can go about actually creating viral content.
That's such a cool story. I mean, 20 years old and founds a company in New York City. I mean, really the business capital of the world, right? To partnering with one of the most powerful organizations in the United States, the National Basketball Association. And what's interesting, Swish and I are both fortunate enough to be participating in the Masters of LinkedIn Summit in May in Los Angeles. And so we've connected in that regard. And since then we've talked and we've written a couple articles. But what we learned is we had a lot in common career-wise. See, I'm Gen X. I was born in 1972. And my goal coming out of college was to work in sports marketing, my dream. And I think Swish and I have a lot in common because like him, I was interning in high school. I was interning as a college freshman, sophomore. I had worked by the time I graduated, volunteered at PGA Tour events, for minor league baseball teams, for major league events, for you name it, I'd gone and volunteered. So when I put my resume in front of somebody, they said, wow, you've been busy. And I remember I interned for a National Hockey League team, the Mighty Ducks, they were called back then. And my first jobs were in sports public relations, which Swish and I wrote about on LinkedIn. I think that story came out January 9th. If you're interested in looking at it, it's called Video Killed the LinkedIn Star. And we had a good time with that. Don't misinterpret that the two of us don't love LinkedIn, because we do. We wanted to point out that there's been a change in their platform, and based on the activity we're seeing on our analytics, the folks at LinkedIn are paying attention and they're noticing, which is cool. We love it. We want it to continue. But what I wanted to say is this is why we've connected. We have so much in common. We're both doing all kinds of things. So what I wanted to ask Swish is, so you've lived in two different countries in the last couple of years. So let's talk about healthcare in Canada. Give me like the 90-second version of how healthcare in Canada, socialized medicine healthcare, differs from a free market healthcare model like the United States.
Yeah, so off the front, I mean, one of the early things I saw were just the difference in cost. I think there is much less cost associated to healthcare here in Canada. Of course, we don't really actually follow a strictly universal healthcare model. Like, there is a privatized model that does cost at a premium rate. But for us here in Canada specifically, when we moved out, we got an Alberta health card, we were given a particular surplus on it every single year. And that probably covered like dental, eye care, and just basic checkups. So it wasn't really anything that we had to pay for other than like surgeries and more higher advanced treatment. And then when I moved out to like New York to the United States, I had to get travel insurance. I had to get my medical insurance from a provider that I had no idea of where they were from, what they were doing. I just went online and searched up a couple of plans. And then I eventually got something at around $600 to $700 for just basic eye care, basic health checkups, everything like that. So I wouldn't say I think the U.S. system gets a lot of flack for being privatized. I think the quality of the U.S. system is certainly better. Like there's shorter wait lines. There's more priority care, I think, within the United States system as opposed to Canada, where you legitimately have to wait 2 to 3 hours just for a basic healthcare checkup. Like that is something that I saw was a big trade-off, as though there's less cost there. In Canada, you're going to have to wait a lot longer, and the quality isn't as great as I think the United States system.
I can already see the comments coming on this episode. I waited in my doctor's office for 90 minutes yesterday. Tell him he's going to wait here too. So
that's just my opinion.
I do think we're getting better at that and that's a lot of what my book, and I have a copy of my book here, Health Wealth, is Healthcare Bankrupting Your Business, 9 Steps to Financial Recovery. A lot of what we're trying to do is to get to where healthcare not only is we reduce your costs, but it's better, and there shouldn't be a wait time, and that's where telehealth comes in. We're talking to a lot of Fortune 500 and 1,000 companies about having a room set aside to reduce absenteeism and lost time, right? Where people can go and there's a video and it's equipped to be private, obviously, so they can not have to leave for 3 hours in what should take 5 minutes. And a lot of times what's cool about telehealth and remote monitors is you can get within the hour, you can just boot up and have a doctor somewhere that can help you out. So there's a couple things. So you said $600 or $700. Is that per year or per month for your healthcare?
Per month.
Okay.
Per month.
So I moved here from another country where so you never had to pay a dime in Canada, or was there no monthly premium?
Only for surgeries, or only for like if you're trying to get lenses, for example, and stuff like that. There are things that the plan doesn't cover, but like any basic checkup, we didn't have to pay a dime.
So how did that make you feel? You're like, wait, what do you mean I got to pay for healthcare?
Yeah, I know. It felt weird. I like legitimately felt growing up in Canada that healthcare was just a right. It was a right that I had. I immediately was entitled to it. But I guess that's also because the tax system is so different, right? Like we're taxed a lot higher here in Canada because we have 3 different sales taxes here in Alberta alone. I know it changes provincially, but I know in the United States, for example, the tax system is very different. And it might not be set up in the same way in order to be able to funnel a lot of that money towards healthcare.
Well, you better be careful. As successful as you're going to be in business, you're going to shoot up to that top tax bracket if you're not there already, and it's going to feel like being home even when you're in New York. So a couple of things that you mentioned that I think we also have in common is entrepreneurism. I worked in corporate America. I worked for the man, as they say, for 20 years, and I read a couple books, and I've never done the like my 3 favorite books post on LinkedIn, but you know what, I want to ask you to give me a recommendation on a business book or a book that inspired you, because the 2 that inspired me to become an entrepreneur when it really wasn't even anything in my mind 10 years into my career was The Millionaire Next Door, which is as basic of a finance book as they come, but it's awesome. And Rich Dad, Poor Dad, which I'm sure everybody's heard about because they've commercialized the heck out of it. But what I loved about Rich Dad is probably 7 times in the first 25 pages it said, if you work for anybody but yourself, you are a slave. Don't justify it. Don't make yourself feel better. That's a fact. You can't deny it. And it took about 7 times before I got mad, threw the book down, and said, doggone it, he's right. Because the first couple times I heard it, I'm like, he's wrong. I have a great job. So tell me about a book or 2 you'd recommend on entrepreneurism for that person that maybe hasn't made that jump but wants to, or even the college student who's not sure which way to go.
Yeah, the first off the bat would be 0 to 1. It's by Peter Thiel. That book legitimately takes conventional business principles and shows you why they're actually false. So an example would be like the first mover advantage. Everyone is like, oh, there's a big first mover advantage. If you're the first company in, like you have such an advantage. No one can compete with you. And what Peter Thiel says is I actually believe in the last mover advantage. I believe in the company that comes in last analyzes which niches in the audience have not been catered to, what product can be delivered at a much cheaper price, and then goes and competes with them, right? And he brought up Lyft as a great example of a company that did that. Most people would have seen Uber and been like, I'm never going to be able to compete with this. But Lyft somehow carved in like good niche, got a cheaper product out, and has a great culture associated to their company as opposed to Uber. And then the second book would definitely be Think and Grow Rich. That's just a classic. There's a movie on it too now. It just teaches you not only how to like go about thinking as an entrepreneur, but how to truly take your life and practically mold it into a high income person. So how to be able to save money, how to be able to look at your tax sheets, look at your income statements, and understand where I can take money off and where I can really spend it to truly build assets with my own. Very similar to, I think, Rich Dad Poor Dad. By the way, I did play the board game as well, so like that was ingrained in my family growing up.
There you go. Well, hey, you know what? I know you're not here as a parent yet, but one of the things that Millionaire and Rich Dad talk about is raising your kids in this manner and getting them a stock portfolio, buying them McDonald's stock or Microsoft stock or whatever they like to do, and saying, hey, pay attention, putting the app on their phone and say, hey, when you're bored at school, instead of going on this social media platform, why don't you go on Scott Trader and see how your stocks are doing? And it's funny because I bought a penny stock for my kids, and it went up, and they got all excited that they had 30,000 shares. And I said, don't ever buy penny stocks, kids. So anyway, great books. I think one of my favorite things about Millionaire Next Door is I live in Orange County, California. I've been blessed to live in an affluent county, and I live in a city, Yorba Linda, that was listed one of the richest cities in the country, but you wouldn't know it because there's all these big lots with old houses and old cars. And in Millionaire, it talks about, hey, do you know who the richest guy in your neighborhood is? He's the one driving the oldest car that you want to move out of your neighborhood. And that was a really good example, because I'm 30 minutes from Newport Beach, and the dream of most people I grew up with here is to move down there, and they were ranked behind our average household income wealth because they were buying the newest car and investing, keeping up with the Joneses. And that's not the stereotype, but I really loved those messages in that book. So thanks for sharing that with us. I want to ask you now about what we call concierge medicine, Swish. And in case the listener's not familiar with this term, in countries where they have socialized medicine, they also oftentimes have a private offering where if you want to pay, you can pay and get access to. People usually think it's saved for the affluent, but we actually see two different versions of this market emerging in the United States. But before I get to those two, I want to ask Swish about his knowledge and exposure to concierge medicine. How old were you when you moved to Canada?
I was 9.
So you lived there from the time you were 9 till you were about 19, is that right?
Yeah.
So, okay, during those years, like, what was your access to, if at all, concierge medicine, and what was your exposure to it?
Yeah, so definitely not me, but I remember my grandparents when they moved to Canada as well. We had to get them privatized medicine, and we had to go through a concierge service. And that's why I actually do agree with you, and I know exactly where you were going. It's not just people who are incredibly affluent who tap into these services. It's also people who need specialized care, and people who directly need something that otherwise they would have to fly to LA or they'd have to fly to another country in order to get. And that's what I think is beautiful about those services is a lot of times people will go through, they'll have to get a transplant done, for example. It'll bother them for 8 to 10 months, the fear of doing it, complications might arise in the meantime, all of that. With a specialized model, you're able to get it done within 2 to 3 months. You're able to get it out. You're immediately able to get it done much faster and with proper care as opposed to going through the public system all the time. So I think it's something great. I think from my grandparents' experience, they loved it. It helped them. They're still alive. God bless them. But yeah.
So interestingly enough, so a few years ago, here's how you know if your doctor is going to concierge medicine. My wife a few years ago gets a letter from her longtime family doctor, and it starts like this. It's got some letterhead you don't recognize. Hey, great news. My practice is merging with this big group, so I'm going to have access to all these other doctors and specialists and equipment, and it's going to be so great for you. And there's this new model that I'm a part of, and guess what? Here's the good news is you get to be part of it. It's only going to cost you $7,000 a year. You get to come in whenever you want. You don't have to wait. Same day, 24/7 telephone response from one of us. And then there's that little line at the end that says it's $6,000, $7,000, $8,000 a year or more, right? And that's in addition to your insurance. So that's concierge medicine, and that does exist in the United States, guys. And I want to use that as a lead-in to a new emerging model And Swish may have had some exposure to this in New York because it's very big on the East Coast. It's working its way west, and it's called direct primary care. So what an employer is doing is saying, hey, if we're spending $1 million a year, let's say a Fortune 500 company on our healthcare insurance, instead of spending $1 million with Cigna, why don't we pull 600,000 over here and contract with a huge physician network in our area where all of our employees are concentrated, and we're going to put 200,000 towards emergency care and all the other specialty cares that aren't included. Because here's what I want to stop and ask you to think about with insurance. What other kind of insurance in America is paying for primary care? It's all catastrophic. Auto insurance, catastrophic. Life insurance, catastrophic. Tornado, flood, whatever, right? So, but with healthcare, we've said, hey, you're going to go to the doctor, insurance will pay for it, which is why it's gotten incredibly expensive. So this new model is not concierge medicine, but if you start with that thought in mind and say, but my employer is going to pay to give me access 24/7 to a primary care network with specialists. This is called direct primary care. It's going to bring everybody's costs down. Satisfaction is going to go up. Have you had any exposure to direct primary care practices in New York by any chance, Wish?
No, but I know that VaynerMedia, for example, run by Gary Vaynerchuk, is also looking into that as employee benefits, which is smart. And so I think a number of these big companies are doing it, like you said. I've heard of it as more of a general movement, and I've heard of it more called employer care, than direct primary care. But employer care, I think, is a great idea.
Cool. And so we're going to have plenty of guests on direct primary care. I know Mike Ochoa from Transcend is going to join us in a few weeks. Kat Quinn, who's back on the East Coast, who's awesome on social media, on both Twitter and LinkedIn, as a big proponent of DPC. And I know Dave Chase is as well within the Rosetta. So we can move on from that topic. I want to ask Swish 2 more questions, and the last one is just kind of a standard question I asked folks off topic. But until we get to that, I want to ask you, so having been in the States for almost a year now, if you were to say, based on my expert opinion of 9 months, having been to the doctor 3 times and to the hospital once, what would you suggest that we could change or tweak to bring costs down for businesses and individuals for healthcare? Because I want to give you a stat as a millennial. At least 40% of your lifetime earnings in America will go towards healthcare at the current pace, which is sad. It's beyond sad. It's tragic. It's going to be 50% very soon. So businesses at the same time, and this is really the premise of my book, is what other expense do you have in your business that is out of control, that you just kind of every year go, oh, another 12% increase, and by the way, they're giving us less for paying more. That would be intolerable, and people would be fired if it was any other one of your expenses. And it's always within the top 3 expenses after payroll, and real estate, usually above real estate. So if you were to give us one example or one suggestion based on your 1 year living in the States of how we should think about reducing healthcare costs and without compromising care, what would it be?
So beyond direct primary care, I would say 2 things. There's 2 things. One is off the bat. There's actually a really cool prediction that I have for 2018, which is I believe baby boomers are going to be the new millennials. And what I mean by that legitimately is innovation and technology is moving so fast that I think the ability for us now to be able to have telehealth, like being able to figure out what illnesses we have and diagnose them from home, is something that legitimately should occur, especially in this year. And I think we should start it off in smaller areas. There are already countries like Belgium, the Netherlands that have this model of telehealth where they'll actually send doctors out to you if you do need specialized care. But other than that, you can get your own prescription through a model like an application or a program that you open up and get direct access to a 24/7 doctor. I think that could be really cool. And also would save a lot of money in going to the hospitals, the wait times, all of that. The second big thing would be just the tax structure. I find it pretty absurd that when you take a look at where your money goes towards as an American citizen, a lot of it is not going as much towards healthcare as much as it's going towards a defense budget, going towards economic security, infrastructure projects, all of that. And I'm saying those are fine. All I'm saying is I think it'd be great if they followed a similar model to Canada from a tax perspective, where you do put aside a pool of money for emergency care, and then you get the government subsidizing a lot of your healthcare in return, which I think would be a cheaper model, at least done in the United States.
I remember being down in Costa Rica for the first time, probably about 10 years ago, and our friend Michaela Alexis is actually down there now. I'm sure a lot of you follow her on LinkedIn. Swish and I both do as well. She's been great to get to know and follow, but she's down there right now as I think about this. But I remember getting a tour down there 10 years ago, and I asked somebody, what about the military? And they said, oh, we just call you in the United States when we need military protection. So maybe that's one of the things that our taxes are going to that Swish is referring to. But he also hit on a couple of other notes, and another thing Swish and I have in common that I say when I speak, and I know Swish is, by the way, a speaker, and when we wrap up, I'm going to ask you to tell folks a little bit more about what you speak about. When I speak, I say, hey, I actually have 2 slides on millennial culture, even though I'm a Gen Xer. I'm a proud Gen Xer. I love being part of Gen X. But what I also learned from folks like Swish and others is there came a time back in 2014 where I said, man, some of these millennials are very successful business-wise in just a short time. Is there something I'm missing? And the answer was yes. I stepped back and said they're looking at the world as a global marketplace, a true global marketplace that they have immediate access to via the internet, and we as Gen Xers and Boomers don't. And Swish, excuse me, I don't say don't, but we haven't ever thought that way.
Yeah, growing up.
Being a global marketplace costs a lot of money to access, right? So now when you're a Boomer or a Gen Xer and you step back and look at it, that's changed, but we need to change to be able to take advantage of it. And one of the things Swish said is telehealth and remote monitoring. I've said from the stage for since 2014 on my 2 millennial slides that 2015 and 16 were the years that millennial culture became American culture. And it was for the exact reason Swish said. I stopped hearing from doctors, nurses, moms, pops, and kids like me that my grandma will never use an iPad. My dad won't ever do that. They had to. The technology was too good. Yep. And I want to make one more point that Swish made. House moms here in the States that have 3 kids and run around all day, or dads, we're always hesitant for change, particularly as Boomers and Gen Xers, right? We're hesitant to change anything. We weren't created that way. Nobody likes change. But all the folks that are being forced, for lack of a better term, to convert to these telehealth, remote monitoring, but you get immediate access to doctor's plans, guess what they're saying the minute they try it, particularly the house moms that usually have to drive a kid to school, go pick them up, or move them from school, sit in the office for an hour, take them back. 10 minutes after their kid says, Mom, I'm sick at 7 a.m., they're sitting in their living room with a doctor on the other end of the TV. Problem solved. No driving anywhere. They love it. And I agree with you wholeheartedly that the minute we stop resisting change and adopt to this new technology, and you pointed it out, not just in Belgium, but man, there's 3rd world countries that are 15 years ahead of us. So it's time for us to adopt. So Swish's 3 suggestions on what Americans can do to drive healthcare costs down and improve health. Direct primary care, telehealth implementation, which he thinks this is the year for, 2018, and also a bigger picture strategy, which is to look at the tax structure. So with that, I want to ask the question I always sign off with, which is, and this is a big one, what is your favorite sports team, whether it's professional or college? I have a feeling I know what sport it's going to be based on the company you started.
Yeah, so it's basketball.
Yeah.
My favorite team is the Los Angeles Lakers.
Wow, all right.
I've been a Lakers fan for like 8 years now, and of course Kobe is my favorite player of all time. But I don't know. I'm a huge Lakers fan. I love the way they play ball. I love the Staples Center. I love the environment in there. But yeah, that's definitely my favorite team. What about you?
Well, we'll have to look at the schedule in May when you're in town for the. I'm sure you already have, right? So
yeah, 100%.
Yeah, we'll have to get that together. So my favorite team is the Dodgers. So this year was a very fun year until the last night of the season. My brother actually played for the Dodgers in '98, but I want to tell you a funny story about the Lakers because I grew up a Showtime Laker fan. I was fortunate to go to some playoff games. I've seen Magic, Shaq, Worthy, all the ones through the years. Kobe, of course. My kids, Gen Zers, born in 2000, 2001, and 2003. Another example of how the millennial age shaped teenagers differently in Los Angeles. My kids are Cleveland fans and fans of the other teams. And I remember a couple of years ago, my last hospital CEO job, they came to me and they said, hey, we have a suite at the Staples Center. So do you want Kings hockey tickets, Clippers basketball tickets, or Lakers tickets? And the Lakers were the worst team in the league. And I looked at my assistant like, You're really? Are you asking me that? Of course I want Lakers tickets. It's showtime, baby.
Yeah.
You know? And it's funny because I bring them home. My kids are like, Dad, why'd you choose Lakers if we could have gone to the Clippers game or to the Kings? And I said, I've obviously raised you wrong.
Yeah.
So I'm glad to hear that you're a Lakers fan. If you could see behind this step and repeat banner here that I use for my podcast and radio show, there's actually a picture of Derek Fisher after he hit the big shot in the championship a few years ago. So Swish, tell the listeners as we wrap up here what you speak about and a little bit more about your company, because you're working on an algorithm I'm hopeful will be out by the end of 2018 where it's not just for celebrities and professional athletes, but you think it's going to have a much bigger impact. So first what you speak about, and then this proprietary algorithm you're working on.
Yeah, so what I speak about, represented by the National Speakers Bureau now, which has been a big relief. I spent about 2 years independently finding my own gigs and negotiating my own salary, which is really intimidating to do.
Yeah, I can relate.
But I mainly speak about two things right now. One is on personal branding, so I love talking about LinkedIn, on Instagram, how to be able to carve out a niche, how to find your audience, how to put out content, and also how to be able to go about networking on those platforms, because I think it is actually a soft skill that a lot of people should learn, especially in school, in my opinion. The second thing I love speaking of entrepreneurship, so how companies and corporations in America, in Canada, wherever, can incorporate a social model. So a model that social ventures employ, how you can take in an idea of spin-off benefits that you can provide to your consumer base and how you can integrate that with your existing product line. So one of the places I've spoken at is Tom's Shoes, which they now, of course, have a social model. Every time you buy a shoe, they donate another to a developing country. That type of model, I think, can be replicated across the field, because these days, in my opinion, consumers care a lot more about your brand as opposed to your product. It used to be the other way around.
Yeah.
Now it's starting to be really focused on what values does this company have and why should I go with them as opposed to this company.
I couldn't agree with you more. I think your Uber and Lyft example was a great one.
Yeah, that's the best example about brand versus product, right? Like Uber has a better product in my opinion. Even though Lyft is a bit cheaper, I think Uber just is better in the sense of they have more cars, a lot more people are using it, all of that type of stuff. But Lyft's brand is just so much better. And it's also very much focused towards younger millennials, right?
Yeah.
Everything just from their color scheme. It's all meticulously designed.
Cool
I love it. And then in terms of Dunk, and like Dunk, of course, is a media network, but I'm building out a proprietary algorithm called Superfan. The hope is that it not only targets celebrities and influencers, but small business owners, people that are trying to build up their presence on social media, because what we do is we target your top fans. So we show you who your top passionate and influential fans are. You can reach out to them and you can reward them directly using some of the product that we've been given to by other brands. And so it's a great way to interact with your audience, to make them feel loved and also to be able to give back.
Cool. Awesome stuff. It's interesting. Of all the questions I asked, the last one is the one where I said, wow, Swish and I are actually a lot closer to our actual business objectives than I know, because with Health Wealth, and you can visit health-wealth.com to learn about the book, but also the loss assessment on how much money your company's wasting on healthcare and how you reduce it. We're going to have an interactive series. But my goal, really my mission, is to travel to Fortune 1000 and mid-market companies around the United States and teach them how to save significant dollars on spending, because we've reached a tipping point where it's putting companies out of business and it's killing the American dream. So I think it'll be interesting to see how long it takes before Swish and I are actually referring each other business, because we're out there kind of trying to do the same thing, change a culture within an organization to make the organization better. So I want to thank Swish for joining us. And this is going to wrap up this episode of the Health Wealth Podcast and Radio Show with Dr. Josh Luke. I want to thank Swish Goswami. If you don't follow him on LinkedIn and Instagram, please do, and Twitter as well. And I want to thank you again for joining us. Tune in again to the Health Wealth Podcast and Radio Show with Dr. Josh Luke. Thanks so much. All right, my brother, that was great.
Perfect.